Hello, my name is Jana Smith, and I'm a Managing Director at ideas42, a behavioral research and design nonprofit. And I'm here to present my leadership project, the formation of a Global Health Advisory Council. So as many of you know, behavior change programming has a very long history within global health, with many successes and some opportunities to continue to strengthen. The application of behavioral science, however, a collection of academic fields leveraging scientific methods to better understand human behavior, is relatively new within global health. And in the last few years, there's been growing momentum from important global actors such as the UN, WHO, USAID, and others to accelerate the application of behavioral science within global health. Now, as a nascent field within global health, behavioral scientists really find themselves at a crossroads, with the opportunity to make important decisions around how the field will move forward, as well as some important challenges to consider that are particular to global health. So for one, behavioral science has been much more effective at driving change within contained organizational confines, potentially more at an individual level of behavior. And within global health, we know that we have large-scale challenges to tackle. We have systemic challenges, those which are structural in nature. We really have an opportunity and an obligation to drive the science forward on how to incorporate different methods and approaches to address these larger scale changes. Second, as an innovative discipline, and is one that is relatively new for global health, we need to make sure that we're learning from the mistakes as well as the successes of those that preceded us. And finally, as a specialized discipline, and as one which emerged from academia, we also have the necessity to make sure that as the application of behavioral science increases, it doesn't exclude those that we seek to serve and engage, and instead that we're finding ways to democratize access to the professional development opportunities that people need in order to enter our space. Now, these challenges are larger than that which one organization can take on, and these challenges are more complex than something that behavioral scientists alone can tackle. So my leadership project is oriented around forming the Behavioral Science and Global Health Advisory Council to bring people who are outside of the behavioral science field, but who bring very specific areas of expertise to the decision-making table as we shape our priorities and determine pathways forward for our field. This includes both disciplinary diversity, which can address some of the more methodological changes that we seek to tackle as behavioral scientists in global health, as well as diversity in lived experience, with particular focus on cultural background and gender, given the kinds of issues that we seek to tackle within global health. Now, the Council will have a strategic advisory role that will be conducted through biannual meetings and targeted consultations on issues of strategic importance. Its governance will be akin to that of a board committee or an advisory council. And the council will be housed at ideas42, the organization where I work, but given its broader aims with facilitated connections to other key actors who are applying behavioral science within global health. Now, again, the council's objective is very much to leverage this moment and to strengthen the potential impact that behavioral science can have in global health by leveraging all of the experience of the global health sector and ensuring a diverse set of perspectives, both disciplinary as well as those of lived experience, are at the decision-making table to shape priorities and agendas. I think my leadership project really illustrates all of the leadership pillars of the WomenLift program. I think the aims of the council, its composition, very much is authentic to my leadership, that of intellectual curiosity, that of an adaptive leader who constantly wants to push ourselves forward and who seeks candor and constructive feedback to be constantly revisiting some of our assumptions. It's inclusive in its approach. We're seeking to put multifaceted diversity at the center of the council. And one of the aims of the council is to ensure that the increased application of behavioral science is done with a vision of inclusivity. It's strategic. It's outside of my organizational bounds and is very much looking to shape the discourse within our field. And it's impactful. First and foremost, I want to propose this council so that we can ensure that the increased application of behavioral science translates into improved health for people around the world. Thank you very much for your attention, and I look forward to your questions.